Welcome to Ask Dr. Geier Live, wherever you're watching. Hope you're making today your masterpiece. My name's Dr. David Geier, double board certified orthopedic surgeon, sports medicine specialist, anti-aging regenerative medicine expert, and media medical expert. I'm not sure if I'm ready to talk about the anti-aging and regenerative medicine, but all of that is true, and it is the one time a week that I am answering your orthopedic questions, injury, surgery, recovery, rehab, whatever questions you have. Feel free to ask those. I do this once a week. I don't really, or don't at all, answer medical questions in comments to videos, in emails sent to me, things like that, anywhere else on social media. I don't have time, and for lots of reasons I can't do that. Part of the reason is that I can't legally give you medical advice. So what we talk about here is meant for information and educational purposes only. All right. I do not have any comments yet that I can see, at least. So for now, I will just talk about, if you do want to see me formally as a patient, I do talk to people from all over the world that come to see me in Charleston, South Carolina. I can't really do it by phone outside of North Carolina and South Carolina, but you're welcome to come see me and might hear about your orthopedic injury and options other than cortisone shots, other than physical therapy, other than surgery. We try to look at all sorts of ways to help that injury heal without surgery, help you avoid surgery, things like that. All right, so my comments are working. Justin says, greetings from Canada. It's good to see you. Where in Canada? I have, my mom's side of the family was from Quebec way back in the day. So I have a fun spot in my heart for Canada. But if you want to come see me in Charleston, there is a link in the description below this, drdavidgeier.com. Go to the contact page, click the schedule appointment, fill out the information about the problem you're having, and either me or one of my assistants will help set that up. All right, Justin says, and Justin is north of Toronto. Fantastic. Question about elbow bursitis. All right, hit me. I can talk about elbow bursitis typically while he's writing more specifically about it. That is a small fluid-filled sac right on the tip of your elbow. We all have that bursa, that fluid-filled sac, but it's paper thin in most people. But it's there to prevent friction and inflammation due to things that aggravate it. So a lot of times you'll see people with this big swelling there because they rest their arm, say, on the car or truck window. You see it in truck drivers a lot. Somebody with repetitive impact to that area would be someone that would do it. Typically, Justin says 49 years old, active in weight training. Usually weight training wouldn't do it. I would say that I guess it could from repetitive tricep motions, although I can't say I've ever seen that. It's usually repetitive compression, direct force to it. Like I said, truck drivers, mechanics, things like that. Having said that, the mistake that some people make, I'm sometimes willing to do it once, but I don't like to do it very often, and that's injecting cortisone into that bursa, not into the joint, but into the bursa, because yes, it can decrease the inflammation, but the problem is that if you do that enough, it can get infected. Also, trying to draw the fluid off almost never works. If you get any off at all, which is rare because it's like a honeycomb, the little septations and fibrous walls in there keep you from getting any significant amount of fluid out, but it typically comes right back. So the treatment is avoiding the repetitive impact, things like that, elbow pads, maybe anti-inflammatory medications, things like that, and sometimes maybe a one-time cortisone injection. But I will say that I have seen and had to do surgery on a number of people with what's called a septic olecranon bursitis, a septic infection, because some doctor somewhere had just done cortisone after cortisone after cortisone shot into it, and eventually it got infected. All right, Kareem. Labral tear of the shoulder 35 days ago. Forbidden movements for me. When can I be totally recovered? Practice sports again. So like I said at the beginning, this is not medical advice. So I cannot tell you when it's okay or when it's not. That is between you and your doctor and based on how you're doing initially after surgery. Typically, though, for a labral repair, you limit getting above 90 degrees, you limit external rotation both in this position and down by the side. It's that external rotation, assuming it was an anterior or superior labral tear, that potentially pulls it apart. Generally, and Kareem, this is not specifically for you because I'm not involved in your care, but generally, depending on the sport, you can get back to sport somewhere around 6 months after a labral repair. But there's a lot of factors in that. Can be certainly longer than that. Very rarely that it would be less than that. Yeah, Justin says went to hospital, meds for infection. So a septic olecranon bursitis, if it's septic, needs to be taken to the operating room and washed out. If it doesn't turn out to be septic, then it's the stuff that we talked about a little bit before. And as far as staying out of the gym, it really depends on if that's truly what causes it. I like I said, I have never seen that. I suppose it's possible, but usually, again, it's people that rest their elbow up against, say, like the car window or the center console in their car, truck window, things like that. If you do a job that involves resting your elbow on a surface for a long period of time, that would do it. But yeah, you could try a period of time of not working out, maybe an oral anti-inflammatory medication, elbow pads, if you do have to rest your elbow down, and kind of see how that goes. All right, it looks like we are going to have a very, very short session today. Lots of comments, but all from basically two people. Remember, if you have orthopedic questions, orthopedic questions, recovery, surgery type questions, I am here almost every Friday. I will not be here next Friday for our normal Friday 12 p.m. Eastern show, but I will be back soon thereafter. So it'll be a 1 week break on those, but you feel free, join us whenever possible for Better Than Ever Live on Thursday afternoons, 5 p.m. Eastern. That's where we talk about health, wellness, exercise, nutrition, sleep, mental health, aging, longevity, all kinds of good stuff. We just did one yesterday. So join us on Thursdays at 5 p.m. Eastern for that. Also, make sure you subscribe to the Better Than Ever Live and Better Than Ever Daily podcasts, and that so that if you can't join us live, you can listen to those on your way to work, on the way to the gym, like where I'm about to go, on the way home from work, things like that. Justin, you are so welcome, and really love police officers. That's really great. Happy to help anytime. Thank you so much for watching. If you missed this and you have questions, again, remember joining us on just about any Friday, 12 p.m. Eastern Time, except for next Friday. But I look forward to answering your questions on future Ask Dr. Geier Lives. Have a fantastic weekend.